Good afternoon, CTS alumni community, and all those that are joining us this afternoon. We are so very excited to come together this afternoon on our first day of giving. So very grateful for this day of giving, having the opportunity to come together to celebrate all things that are CTS. As has already been shared earlier in the day, our goal for this day is to celebrate our programs, our alumni, our faculty, and our students, and also having the opportunity to continue our alumni speaker series that has been occurring over this past year and has been shared a couple of weeks ago. We kicked off a special portion of this series focused on ministerial self-care, mind, body, spirit, and soul. And during our last panel, I shared that I had read that the month of April is Stress Awareness Month. I was not aware of that prior to then, but the reality is, with everything that we have experienced in the pandemic, even prior to the pandemic, we recognize how stress impacts our lives. And we also recognize the vital importance of therapy. And that's what's so exciting about this opportunity to come together this afternoon to focus on our counseling center and therapy. We also recognize prior to the pandemic, during the pandemic, and prayerfully as we emerge from this pandemic, our therapists are needed like never before. When I've spoken to our alumni and our practitioners, many of them have shared that their practices are full. So we know that there are so many that are in need, but we also recognize, just as our ministerial leaders, our therapists are pouring out on a daily basis. So the topic for this afternoon is Therapy for Therapists, Preventing Caregiver Burnout. But before we get into our dialogue, two things that I would like to do. One, I want to thank those who have already given to our day of giving on this day. Thank you so very much for your gift and your contribution. And I encourage those, if you haven't had an opportunity yet to give, please feel free to hit that give button on the Facebook page and also on our website. And then secondly, I want to have the opportunity to introduce our panel. I'm so very grateful to be joined by our extraordinary leadership of our counseling center and our faculty and our alumni to have this really important conversation about how we ensure that our therapists and those that are really pouring out and facilitating the mental and emotional health and supporting those in need during this time receive the supports that they need. So I want to have a chance for each of them to introduce themselves and share a little bit about their background before we get into our dialogue. Suzanne, can I begin with you?
Certainly. I'm Suzanne Coyle. I'm the director of the Marriage and Family Therapy Program here at CTS. We are a nationally accredited program. We've been accredited for over 25 years by the Commission on Education for Marriage and Family Therapy. And my background includes a lot of different paths. I hold an MDiv as well as a PhD, which is in pastoral theology and communication from Princeton Theological Seminary. When I began seminary, I intended to become a chaplain, and the last thing I ever wanted to be was a therapist. So here I am. But my path has gone through doing ministry in inner city Philadelphia when I was Southern Baptist. Then I became American Baptist after I was ordained Southern Baptist. And my home church was disfellowshipped, and I became a heretic in some people's eyes. And so my denominational affiliation now is with the American Baptist and Disciples of Christ. I've spent 12 years being a pastor in various congregations in rural New Jersey, in suburban New Jersey, and in Southeast Indiana. In addition to that, I worked for a period of time with the Baptist Homes for Children in Kentucky, and I directed a 22-site faith-based network across the state of Kentucky. So I drove a lot. So in addition to that, I then started here at CTS as a faculty member. I'm the core faculty member in marriage and family therapy here at CTS. And in addition, I also teach some ministry courses because here at CTS, I've been able to combine my strengths as a pastor, as a licensed therapist, and on the side as a spiritual director. So that's me.
Wonderful. Thank you. Such a robust background. Thank you for sharing. Nicole?
Good afternoon, everyone. My name is Nicole Robertson. I'm an assistant professor and the director of the clinical mental health counseling program here at CTS. I am originally from New Orleans, Louisiana. Similar to Suzanne, I am ordained in the Baptist Church Fellowship and have been in ministry for over 25 years. I too have many stories of ministry and different roles and responsibilities there. However, it was a part of my call to ministry that I sought out an opportunity to become a licensed clinician because of the need that I saw in my local church fellowship. And so I have background in church ministry along with being a licensed mental health counselor. I also provide instruction and supervision here at CTS for individuals who are pursuing their clinical mental health counseling degree while they are here. I have been in Indiana or Indianapolis and here at CTS for about a year. So I'm glad to be here on today.
Great. Thank you, Nicole. Truly appreciate that. And I think what you both have shared thus far is just the powerful integration of the work of CTS, of ministry and mental health therapy. So thank you for sharing on your backgrounds. Brian?
Hi, I'm Brian Botan, the clinic director at the Counseling Center here at Christian Theological Seminary. I'm also an alum. I'm a 2013 graduate of what's now the Master of Arts in Clinical Mental Health Counseling program. I'm a licensed mental health counselor in the state of Indiana and an approved clinical supervisor. I have postgraduate certificates in object relations theory and practice and psychodynamic supervision and consultation. When I'm not directing the clinic, I hold a small private practice, to keep my clinical skills in good order. I'm glad that you invited me to be part of the panel.
Thank you, Brian. Appreciate that. And thank you for referencing the fact that you're an alum. That's another
Yes.
powerful piece about our work, that many of our alums actually work at CTS. And now we'll go to Amanda.
Hello, my name is Amanda Thrasher, and I'm also an alum of Christian Theological Seminary in the Clinical Mental Health Counseling program. And I'm currently the owner and licensed mental health counselor of Threshold Therapy, LLC, and really just getting started in this portion of my career. Though my background I really see as very interwoven in the work that I currently do. So my background is primarily in youth ministry, youth mentoring, and a variety of spiritual contexts, as well as psychological research at Indiana University. And I'm also trained as a yoga teacher. And so I see that work of mindfulness and movement as integrated in my work as a therapist and throughout what I've experienced in my background as well. So I'm so glad to be here. Thank you.
Thank you, Amanda. Appreciate you joining us as well. So we want to get into our dialogue. And as we get started, I want to talk a little bit more about the Counseling Center and some of the impacts that we've seen over the last year. And then also getting into our dialogue of just some practical ways that we can address caregiver burnout and ensuring that our alumni and the broader community that are listening today can receive some concrete ways to ensure that they are filling themselves up as much as they are pouring out. But my first question, as I referenced earlier, we acknowledge this pandemic has had a significant impact on mental health therapy, the reality that we are facing and have faced global trauma. And as I've spoken to alums, as I've shared, their practices are so very full. But I want to talk a little bit about how this pandemic impacted the Counseling Center and the work that you all do, and also your therapy practices. So Brian, I pose that question to you. How has the pandemic impacted the counseling center?
I think maybe a better question is, how has it not impacted the counseling center? So yeah, a little over a year ago, we decided to close the building for in-person sessions and go to an entirely virtual operation. And just like many other clinics, practices, people in private practice, we sort of had to learn how to do telehealth a little bit on the fly. I think we've gotten much better at it as we've gone along, as I would imagine most of the industry has. But I think it's shown a couple of things. I think it's shown kind of the power of technology in terms of reaching people. I think about what mental health care would have been like if the pandemic would have happened, in an era without Zoom or the ability to have secure video conference teletherapy. So I'm really grateful, actually, for the technology that we have, that it's been able to allow us to maintain client relationships and continuity of care in a lot of our clinical relationships. I think it's also allowed us to extend our reach a little bit. Historically, we've really served kind of the neighboring community of the Butler Tarkington area and a little further out, but people don't have to drive to us right now. So we're seeing and serving people, outside of the greater Indianapolis area. Obviously, they have to be residents of and physically present in the state of Indiana. But I also think that it kind of reveals some limitations to it. I think the longer that we get into the pandemic, and the longer that we remain apart, I think it shows really just how much physical bodies crave to be in the presence of other physical bodies, and that there's something really powerful about that. We live in a technological age where a lot of our socialization happens, on these things. And I think, if anything, the pandemic really has shown kind of the pros and cons of that. Obviously, there's been a lot of situations where we've been able to maintain contact with loved ones, particularly when things were more locked down, through technology, but also just how much I think we take for granted that physical being in the physical presence of another person, and certainly that's impacting people's mental well-being, for sure.
Okay, great. Thank you. And it is a blessing. I mean, sometimes I say Zoom is a blessing sometimes and not, but the reality is, when we think about the needs that continue to be serviced through online technology, it is a blessing. But I also acknowledge too that piece where that coming together in communion together in person makes a world of difference as well. So grateful that we were able to continue to service the clients that were deeply in need throughout the pandemic. Suzanne and Nicole, I'd like to talk to you a little bit about some of the unique training that is provided to the students through the training programs at CTS related to mental health therapy and marriage and family therapy, and also just your insights on what have you seen as far as shifts for your students as well over this past year. Nicole, can I begin with you?
Sure. I think that some of our unique training that our programs take a look at is the work of the therapists. So how is the therapist themselves, she or he, or however they might identify, really understanding their issues and concerns that are going on? So some of the unique trainings that we offer or ask is that our clinicians in training actually prepare themselves and are in therapy themselves. And so they are asked while they're in clinical experience to be able to see a therapist to deal with some of the issues and concerns that they may be facing, just as their clients are coming in and talking and sitting with them. But I think another unique aspect of both of our programs that we have is the integration of spirituality and spiritual context, really being able to understand the role of how the divine shows up in our lives and in situations and circumstances that we might face, and particularly in the counseling or therapy experience. And so I think that we work to help our students to be able to recognize and see issues and concerns that their clients are facing, understanding the difference between their clients' issues and their own issues, and really working to be able to provide a presence and a space that's unconditional, that's non-judgmental, and that is welcoming for any issues and concerns that the client may bring up. Understanding as well that a part of their training as well is taking care of themselves. So this element of self-care for the therapist to avoid burnout is something that we teach our students as well. How do they make time for themselves to be able to take care of themselves? And so that is a unique niche as well of our respective programs. I'll defer over to my colleague Suzanne to add more information as it relates to the issues and concerns of the marriage and family therapy program.
I'm glad to address some of our most recent kinds of changes in the marriage and family therapy program. We just completed an arduous 3-year process of being reaccredited with COAMTE, the national accrediting body for marriage and family therapy as a profession. And now we're in an interim period and we're gearing up for a new version of standards in that same organization. One thing that's happening in those standards is there are 3 new emphases that we are currently integrating in the program. One focuses upon how MFTs engage with communities of interest. The other one focuses upon how MFTs collaborate with other professionals. And the last one is how do we prepare our students for telehealth? So I'm going to address the last one and then move into something brief about 2 unique things we're doing currently in our practicum supervision. In the telehealth component of the new standards for our accrediting body, we are now implementing that. I'm currently teaching the introduction to MFT practice, where we do a lot of role plays, and it's a challenge on the Zoom screen because if I'm doing a professor demonstration, I might have the husband up here in his little Zoom box who's a student, and I might have the wife who is another student in her little Zoom box. So we try to integrate that. But we're very excited because we're having on one of our last class sessions, one of our really outstanding graduates from our MFT program who does telehealth nationwide. And she recently, last year, did some workshops at the National Marriage and Family Therapy Conference. So we're going to have that opportunity. It has been challenging with telehealth because one thing we MFTs do is something called live supervision. It is a unique kind of supervision modality in that a student will bring a couple, usually to the counseling center, and the intern works with the couple in the counseling room. At the same time, there is an observation team observing what's going on in the actual session in real time through a one-way mirror. And we can't do that now. So what we've been able to do is to go to Zoom. So we bring the client in, and we turn off our cameras, our video portion. Those of us, me as a supervisor, I'm an approved MFT supervisor, and we observe what's going on in the video component, where we see the couple in their Zoom box and the intern in his or her Zoom box. One thing that is unique about that particular process is this semester we've been doing something that's very exciting. We've been talking about how do we actually implement spiritual interventions. Our work will be part of a chapter in a forthcoming book. I have contracted with Springer, and the book is Spirituality in Systemic Family Therapy, Supervision, and Training. And so it's been kind of an irony to believe that we can observe true spiritual moments in those sessions on something as cut and dried as a technological platform. So the students have really grown from that. And the last thing I'll say that really is around technology too, our last supervision group this month, we're going to have a participation by the interns in what's called simulation application for therapy. It's a new cutting edge program that American Association for Marriage and Family Therapy has implemented. And so in real time over Zoom, there will be an actor, actress, I think in Los Angeles, who will be playing the role of a client, and it will show for us here at CTS as we observe it through Zoom like it's a cartoon. So the actor is really an avatar, and the student will be interacting with the avatar in real time. It gives them an opportunity to interact and to think about different specific possibilities in working with clients. And so we are focusing in this experience on how to do a culturally sensitive interview. So we've been doing a lot. So we're excited about all of this that's going on this semester.
I'm usually not the one who's muted, but I just said that is absolutely extraordinary. And I believe that what you two have just described just speaks to how robust the programming of CTS is and the Counseling Center and all of those pieces. And you've also touched on something, the next part of our dialogue that I want to get into, because I posed this question to our last group of panelists. We know that in God's word, he multiple times says, rest, Sabbath, take a break. Everything you all have just described is extraordinary. And as I shared, many of our alums who are therapists have shared that their practices are full. Why is it so difficult for us to rest? Or is it difficult for us to rest? Amanda, I want to pose that question to you.
Thank you, April. It is difficult for us to rest. I think there's some similarities with working in a pastoral setting and being a therapist, in that there's a sense of needing to be like a superhero to the clients, to the folks that we're working with. And it becomes hard to put down the responsibility and to step away and resource ourselves and really re-energize and revitalize. And I think that rest can also, when we start to focus on the outcome, which is really important because a lot of our clients are suffering and we want to stop that suffering. We want to really help them, have a magic wand there to really alleviate the suffering quickly. But a lot of times it's a slow and arduous and a process that involves a lot of unknowing, uncertainty, and patience. And so when we focus, in my experience, when I focus on only the outcome, then it makes it more difficult to actually take a step back and remember to rest. And I think it's not only just stepping back outside of the counseling sessions to rest and taking that Sabbath and going on retreats and setting up routines that really help to restore us. But also in the sessions with clients, there's a way in which urgency might come up in moments with them, and taking a step back to rest, to reflect in that moment with the client. Is this urgent or is this important? And how can I respond to this in a way that is honoring of what the client needs and also paying attention to how my body feels, what's happening for me in the moment? So I say that to say that there are so many different layers to the type of rest and restoration that we each need. And there's a lot of difficulty in getting there.
Thank you, Amanda. I know that's a challenge for many. Brian, what are your thoughts on that, the idea of rest?
That's a good question. I think difficulty with rest often has a lot to do with the context of our lives. I'm thinking about kind of early in the pandemic. There was a lot of kind of superhero. We got to get a lot of stuff done because we got to transition everything over to this virtual platform, and there was just a lot of lifting up of people who were doing kind of frontline work and caring for people, and understandably so. I think though there's always kind of the come down from that, and when there's a lot of things in motion, there can be this pressure to kind of keep them all afloat or keep them moving. Sometimes it might feel more difficult to allow something to pause or to stop than to keep it in motion. Frequently, the thing that we were trying to keep in motion is actually ourselves, as opposed to the thing itself. So it can be harder to slow down. It can feel more potentially painful to slow down. That the consequences of resting may be more painful than refreshing. And that takes skill and practice to be aware of, and I think it takes intentionality on behalf of particularly clinicians, planning time off, or planning self-care, planning time to refresh and reset is really important. It can be more difficult to just sort of take time when you need it in the moment, because there's a lot of responsibilities that a clinician has, to patients, to their practices. So planning is really important. We teach a lot of that at the counseling center and our supervision groups. How do you take care of yourself? Because a fatigued, a burned out clinician is not going to be able to be of much help to their patients. And I think the pandemic has really put a lot of challenge into that notion. There's a paper that I read early on in the pandemic. It was called "Transference in the Time of Corona" by an Israeli psychoanalyst. Her last name is Roth. She talked about the pandemic being a wall coming down, and essentially a shared trauma by everyone, patients and therapists included. So there's this moment where both the patient and the therapist or counselor are going through the same thing, and how does the clinician position themselves in a way to be therapeutic to their patient. And so it really, we've all, I think, really kind of stretched what we've previously known to be possible about what we can do. And I think the adjustments that we've had to make are pretty remarkable. And I think we'll be seeing kind of the impact of the pandemic and how we've had to adjust to it for quite some time.
Thank you, Brian, for sharing that. And I think something you just said resonated with me. The reality is that this is global trauma. And so the practitioner and the client have experienced the same thing. And I think that's why it is so very important that we focus on that. Something Amanda shared last fall that resonated with me. She said we have to focus on radical self-care, So I'm curious, when I say that, radical self-care, and thinking about for yourselves and also the students and the clinicians, what does that look like? What is that in practicality? What are some of the daily disciplines that you all might recommend that we put in place to ensure that those who are in therapy practices really focus on that radical self-care and able to sustain themselves even through such an extreme time that we've experienced? Nicole?
The first thing that comes to mind when I think of radical self-care is, as Brian talked about, making a plan for it, but then what do I do every day in order to take care of myself? So one of the things I'll just use for myself as a clinician and as someone that's modeling that for students is every day waking up and saying, I have to take care of myself first. There is a prayer, if you will, that sits in my office that says, Dear Lord, please help me to prioritize my health and give me the strength to do what is wise and needed. And so that is my thing that I start off with. So each morning I try to wake up and take an opportunity to go for a walk. Just something as simple as a 15-minute walk in the morning before I get my day started is something that I intentionally set myself to prioritize my own wellness and my own health, because I understand that if I'm not well, and if I'm not healthy, how am I going to provide a space and a place for my clients that I see, for the students that I teach, and for the individuals that I supervise as well, or for just my day in and day out interactions? So that little 15-minute time just to take care of me is something that I do intentionally. So it is planned in my schedule as all of my are planned. It is a part of my day that I do as an interaction. And then in between, if you will, hour upon hour, taking an opportunity just to step away, if you will, Zoom screen from the interactions with clients, interactions and meetings. So every hour on the hour, taking 5 minutes to just step away from the screen or step away from the environment. Something as simple as I teach my students to avoid contamination into sessions or into classes is going into the restroom. And of course, as a part of our COVID training and CDC awareness is washing our hands, but it's something just taking the action of washing your hands and doing that thoroughly that tells me I'm washing away whatever situation or circumstance I was just dealing with and able to go into the next experience and be afresh and be anew and ready to encounter that. So those are some things, being intentional about your opportunity to take care of you and prioritize your health.
Excellent. Thank you. I love that recommendation to go. We've been washing, all of us have been washing our hands a lot. So the opportunity to just wash that away and release that. And then as you've shared, just simple daily practices, beginning the day in prayer and those walks. And I know I've talked to other folks and other colleagues and therapists who said that's a pivotal part of their day as well. And I'm grateful that the weather is better so we can actually get outside and have some sunshine, because sunshine definitely lifts our spirits. How about you, Suzanne? What are your thoughts on that when we talk about radical self-care?
I think there's a real irony as we think about the pandemic in that and the concept of radical self-care, because I think what has happened, there are several research studies in the family therapy field about how have people taken care of themselves. And I think it's actually become, and the research supports this, that some of the things people used to do and then quit doing when we would go out to plays and concerts and sports events is that of what do you do in your home? I mean, I'm a family therapist, so I think that one thing that's really critical, and this is one of my main ways of self-care, is getting support and sustenance from my family, connecting with others. I think God created us to be relational beings. And yet there's a challenge in that. And even therapists sometimes have families that are not supportive of them to speak what is usually unspeakable here. So I think it's critical that no matter your marital status, single, married, divorced, whatever, it's really critical to take care of your relationships, which is a way of nurturing yourself and creating, in addition to family, your circle of friends, your family, doing that um, in every kind of way. My son is visiting us now from New York, where he's an astronomer, and we are working to Skype with my brother-in-law and my sister-in-law because he is here. So that's a way of self-care. The other way I just do things individually is through my own spiritual practices. I'm working now to increase the role of mindfulness in my personal life and in what I do as a therapist. So those are some thoughts. I'm thinking that how we blend the non-technology with the technology.
Excellent. Thank you. Again, as we've talked about, technology has been a blessing. And so it has the opportunity for us to relate and connect to each other as well through that process. The next question I wanted to pose to you all is this idea of a sabbatical. Do therapists take sabbaticals? Who would like to answer that one first? Amanda, can I go to you for that?
Sure. Well, I have not heard of many therapists taking sabbaticals, but I know of a couple of psychotherapists in practice who intentionally mention when they first start meeting with the client that they might take a month off, 1 month of the year, to kind of reacclimate and re-energize. And so I think it's a good question. I think that sabbaticals are countercultural. It's not something that is integrated into many careers, and I think it's necessary and important, and up there with the weekly Sabbaths as well. So as I'm forming my private practice and trying to build a daily life that is restorative and asking those questions of self-care practices in the daily. And I'm also looking to the future 10 and 20 years and how am I going to make sure that this career is sustainable? So I'm in the process of asking those questions for myself. How could a sabbatical be possible? How could taking a month off still serve my clients, but also make sure to replenish me as well?
Excellent. Thank you. Brian, what are your thoughts on that?
Sure. It's an interesting question. I think it may depend on how we define sabbatical. I think there's the word Sabbath in there. Sabbath I believe, I'm not a biblical scholar, I'll have to defer to my colleagues on this, but there's something about one day of the week, right? And so I know in academics, sabbaticals can be, several months at a time, but I often think of how can sabbaticals be something in the moment? How can there be momentary sabbaticals, or something that's refreshing in the short term? I think it certainly is difficult for someone who's seeing clients to take an extended time off, something like a month or so, depending on what kind of care they're providing. But I wonder about kind of Sabbath as a way of life, a way of being that goes beyond just kind of taking time off or disconnecting. Hopefully a Sabbath. While there may be some disconnection, it may be a reconnecting or a differently connecting to other parts of ourselves that don't get as much attention, or engaging in practices or activities that enliven us and enrich us in different ways. So I think it depends on how we define it, and I think there's probably room for a lot of subjectivity there. So.
Thank you. Yeah, I think you raise an excellent point, and just thinking about therapists that are serving clients, the difficulty of taking an extended period off, but a Sabbath rest, that's in the word as well. One day to have the opportunity to step away. I started to integrate that spiritual discipline into my own life, and I was surprised of how difficult it would get to 1 o'clock in the afternoon, and I still had not rested for that day. So I said, okay, and now that I've practiced it, I'm getting into the flow of doing it for that full day. But Nicole, what your thoughts is that on that as well? When we think about just taking a Sabbath, is that a way for our therapists to really sustain themselves over the long term?
I believe that it is. I think that what Brian kind of alluded to as this finding those moments of rest, and I apologize for the background noise, but finding those moments of rest are very significant. As you just alluded to, April, a day. Where is just a moment of Sabbath? Is there a day where I say that there's no clients, there's no other work, there's no other ministry opportunities? So taking, if not months off, if you will, as some would recognize a sabbatical, is there just one day that we could set aside? And so I try to put that in practice myself, as our work days during this pandemic have run all together, and sometimes have found myself either working and or seeing clients and or engaged in supervision almost 7 days a week. I had to recognize that that is not sustainable. And so then what do I do in order to correct course or to change course? Recognizing that if I'm going to work, then I need to set some boundaries. So I think a sabbatical or some time of rest is about setting boundaries in our lives so that we are allowing ourselves that time to rest and replenish. And so what does that look like? For me, I said to myself, one day during the weekend, I will not do anything related to work. If it just means that I will sit and watch all of the television shows that I haven't watched in months, I will do that, but I will not do anything related to work and or ministry on that one day. I will take that opportunity to take care of me. And so that's how I've seen it. I think it's important, if we cannot find the time to take opportunities for multiple days or multiple weeks, how do we incorporate that weekly in our daily experiences?
Excellent. Thank you. Yes, I think that makes it more realistic, and just looking at that single day. And you said a word that also resonates with me, that boundaries. How do we set those boundaries? And sometimes I like the word boundaries, and sometimes I don't like the word boundaries, because the more boundaries we set, it's almost a mindset that we think we can't do more if we set boundaries, but I've found we actually can be much more productive by setting those boundaries and having the opportunity to refuel ourselves. Suzanne, I'll pose the same question to you as well. This idea of Sabbath, and is that something that you encourage your students and your clinicians to focus on as well, or taking a Sabbath?
I try to. Do I think I'm actually very good at it? I'd have to confess, no. Because I think the pandemic has increased all of our workloads, to be quite candid. At the same time, I do think, I think it depends with students. It's really hard for students now because most of them have families. Most of my students work at least full-time, some part-time, but majority work full-time. And so it's hard to take off time. But I do think that some of my students do take off some things on the weekend. I had a student recently who loaded up his wife and 3 boys, and they took a road trip to the Grand Canyon. I don't know whether that's rest or not, but at least it's different. And I think in therapists, when you're out of school and in practice, if you work in an agency, then you do get some vacation time. I think it's harder psychologically in your head for therapists to take off time if they're in private practice. I was in a full-time private practice for 4 years when around the time my son was born. And I think what I did was I did take off time. I would take off 2-week intervals. And what I think you have to do is do your workload such that you can save up what money you need, because I think the primary obstacle in private practice is the thought you're thinking, oh, I'm not making money. I'm not making money. Some people may think their clients are in jeopardy. I actually believe that clients are a lot more resilient than we therapists want to believe. So I'm not for encouraging dependence in clients, but I am for being responsible. So what you do is you have a colleague and you reciprocate and tell the colleague, hey, I've given them your office number if they have a real problem. So I think those are ways that you go. It's interesting. When I was doing training in New York at a Family Institute there, the psychoanalytic community would always take a full month off in August. And it was so common, in fact, that there was a novel that came out called August. And it was the story of the therapist dilemmas and the client's dilemmas without their therapist. So now we think we have to be available for folks around the clock, which I don't think is very accurate. It's certainly not helpful.
I would completely agree with that, and not sustainable. 24/7 is just not sustainable. And I think that's a lot of what we've been able to talk about today, and really just sharing some practical ways to prevent that caregiver burnout. And it is a unique situation because with therapists, it's that one-on-one connection that you have with your clients and wanting to be sure that they are effectively served and supported. Before we close out our conversation, I wanted to have an opportunity as well. Brian, you and I have talked about just the increased need that we've seen at the counseling center. And there might be some who in our broader community might be hesitant to seek out assistance and seek out therapy. But as we've already shared, the pandemic has had such a significant impact on our mental and our emotional wellness. So just want you to share a little bit to our broader community as far as the opportunity to receive support from the counseling center.
Sure. Yeah, our counseling center, services are provided by interns in our Master of Arts in Marriage and Family Therapy program, as well as our Master of Arts in Clinical Mental Health Counseling program, as well as postgraduate residents who already have their master's degree but are working under supervision to get their hours for full state licensure. We operate on a sliding fee scale, so we really try to make treatment affordable for people who need it and otherwise are struggling to find the resources for it. I think there's a lot of stigma around seeking mental health services or family or couples therapy, and sometimes, and I think the pandemic has really highlighted this, that none of us are invulnerable to the impact of stress. And sometimes it can just be that you need somebody to talk to. You need some help to de-stress or to get some new practices in place. And if that sounds like you, then feel free to give us a call. Our number is 317-924-5205, and we can help you get started with the process. But I think it can be a matter of taking care of yourself or helping to take care of some loved ones that you're in a relationship with. I think that we provide really good services at the counseling center. We have some talented clinicians and supervisors that work with our clinicians. So yeah, if you're in need, please do reach out, and we'll see what if we might be able to help.
Great. Thank you, Brian, for sharing that. And I think that part of the pandemic has just also revealed we're all human. And so that encouragement and to recognize that God has blessed individuals like those that you see on this screen to provide the resources and support that we need in going through life and our experiences in our life. So that is a true blessing. Well, I just want to thank each of you once again for coming together this afternoon to have this vital conversation. It is so very important. As I shared, we're continuing this dialogue around ministerial self-care, but it is unique for therapists. And so this has been a great education for me as well this afternoon to really speak about this and the challenges and opportunities, but I think has already been raised. Sometimes it's just those simple daily disciplines that we can put in place to prevent burnout and to ensure that sustainability, because we need each other. And we need you all, definitely. We all need you all, as many of us seek out your support. So just thank you so very much for the extraordinary work that you do on a daily basis. I have been just so very extraordinarily impressed by how CTS as a seminary was able to shift and to continue to provide the extraordinary resources that are necessary for the community and for the students and the alumni. So I just celebrate each of you for the work that you do on a daily basis, and grateful for you coming together this afternoon for our time. And before we close out, I just want to again have the opportunity to thank all those who have participated and continue to participate in our Day of Giving. Again, thank you so very much for the gifts that you've made to the seminary. Every gift matters. So we are grateful for your generosity in supporting this amazing work that is done at CTS. And then I also want to send a special shout out to our alumni who should have already received a couple of notices. We will be having an alumni happy hour this evening at 6 p.m. There's a Zoom link that you should have received. I'm hopeful that we can all come together this afternoon. We're going to do some breakout sessions and just have a chance. We've already acknowledged that technologies are a way to engage. And so during this happy hour, this is a chance for alums to come together and just fellowship and see each other. So I hope that you can join us this afternoon and join us for the rest of the day of activities for this Day of Giving. Again, thank you for your participation. Thank you to our wonderful panelists, and I look forward to a great rest of the day.